Greetings all. This is David Flamment from the African Development Bank. I'm today based in Côte d'Ivoire in Abidjan. It is a great pleasure to be joining you today on this panel of the Africa Security Symposium. Panel 5, Health Security. I see that we have today on this panel a number of people who might be a lot more knowledgeable than I am about issues in health. Today we are joined by Mrs. and apologies if I do not pronounce your name properly, please correct me, but we are joined by Mrs. Marta Garcia-Argenal, who is hailing from the healthcare team of the UN Procurement Division, UNPD. We are also joined by Dr. Zabalon Yuti from the World Health Organization. And we are also joined by Dr. Girum Hailu, who's from IGAD, and more specifically from the IGAD's Health and Social Development arm. So today, before I let every one of you introduce themselves in more details, I will quickly complete my own presentation. So my name is David Flamment. As you might have guessed from the name and the accent, I am a French citizen. I've been living in Africa for the past 15 years, initially in Tunisia, and then I moved to Côte d'Ivoire. All this time working for the African Development Bank. I'm a former military and I currently serve the African Development Bank in the quality of Chief Security Officer. Now, the reason why I was proposed by my organization to take part in this particular panel is that I have been involved in the 2014-2015 Ebola crisis here in West Africa. And as some of our colleagues here at the African Development Bank have been very busy trying to help the organization go through this COVID-19 crisis. So with that said, I will invite everyone to introduce themselves in more detail so that we get to know each other. So Marta, ladies first, if you would please.
Thank you so much, David. My name is Marta Garcia-Argenal, and I am a procurement specialist within the Department of Operational Support and the Office of Supply Chain Management, where the United Nations Procurement Division is located. I have over 15 years of experience in procurement and over 5 years of experience in actual peacekeeping procurement, which is the focus of the UN Secretariat and the UN Procurement Division. We support operations for all the UN peacekeeping missions and political missions as well. Before that, I was a procurement specialist for the United Nations Development Program, located as national staff initially, and then through Central America, as well as the World Bank as a portfolio manager for credits and loans for Central America.
Thank you very much, Marta. If I may please call in next on my screen, I've got Dr. Girum Hailu, if I pronounce your name correctly, sir.
Thank you, Dr. David. My name is Girum Hailu. I'm a medical doctor and a public health specialist. I've been in the health sector for more than 20 years, and I joined IGAD 8 years ago, and I'm now serving IGAD as a senior advisor for IGAD Health and Social Development Program, and currently relevant to our discussion, I'm the regional coordinator for COVID-19 response from Addis Ababa, and I'm also representing IGAD for African Union Continental Response against COVID as a coordinating committee member. And I'm very, very glad to be on this meeting, and I will be happy to present what IGAD is planning to do against COVID and in cooperation with the member states and also the development partners, what are the plan and the strategy and all the details. I thank you very much.
Well, thank you very much, Girum. And finally, we do have with us today Dr. Zabalon Yuti. If you may introduce yourself in more detail.
Thank you, David, and thank you, colleagues. It is really a privilege for me to participate in this panel. My name is Zabalon Yuti, originally from Uganda. I have 23 years of experience working as a medical doctor, public health, but also working with health emergencies. My initial experience was really working with the countries at the national level, then later at a regional level, where over the last 8 years, I've been able to travel to 32 countries in Africa, supporting the health response on the ground, seeing the people who are suffering and getting local solutions based on the global guidance. So 2 years ago, when I participated in this meeting in Nairobi, I would like to recall 2 things which I said, which are going to be relevant for our discussions today. One was strong local action with global guidance. If you don't take that local action, you don't contain the disease at all, and the suffering continues. The second point I made on that day, which will be relevant for today, is nobody is safe until everybody is safe. So if there's still a pocket of something somewhere, we need to work together, emphasizing solidarity so that we support those areas. So I'm the acting regional emergency director for WHO African region, based in the regional office in Brazzaville, which covers 47 countries of Africa, sub-Saharan part of Africa, including Algeria in the north. So 47 countries. I'm the regional emergency director for health emergencies. And then a good number of my countries out of the 47 are having huge humanitarian issues, humanitarian responses based on conflicts, like in the Sahel region, South Sudan, and the other countries, based on natural disasters like we saw in Mozambique, and other countries where really flooding and so on occurs with significant displacement. And then lastly, of course, political upheavals here and there. Sometimes these days when there are political elections, they don't end up with just elections, they end up with violence. So this leads to displacement of people, and therefore the health needs and the other social needs. So I'm glad to participate in today's discussion. Thank you very much.
Thank you very much. And before we go any further, indeed, I just remember Antoinette's encouragement to remind everybody of some housekeeping rules. Just like in any other meeting, please make sure that your phone are not going to ring and interrupt the rest of the team. And just be careful to switch on and off your microphone when you wish to speak or when you don't wish to speak, so that we don't capture any background noise emanating from your location. Having said that, let us start. So today is indeed panel 5 on health security. Very quickly, we are living in a very unusual period in time, since we've been all throughout the world living under the threat of COVID-19. It's been many months for some of us working from home and being under lockdown. This threat has impacted all of us, our countries, our organizations, and all organizations, whether they are private or public, have had to adapt to keep their business continuing. We have had to take measures specific to our own organization, but some might have been shared to make the most of the situation and keep our business going. However, some of us, and I can see all of us, are working for organizations which are not only concerned with saving themselves, but which also have a very important role in helping others to save themselves on various levels. So today is a very good opportunity for each one of us to learn more about other people's experience, anecdotes, tips and tricks, pieces of advice that we may apply ourselves, individually or collectively, working together in partnerships, to try and live through this COVID-19 crisis, but also in the future, as other pandemics may, in our lifetime, arise, that would help us to be more prepared, to be better prepared, should such an event, similar event, arise. Having said that, I have received many proposed questions around those themes. I'm going just to go through them and invite everybody to try and provide us with such examples of what we can do, what we have done, and what we will be able to do in the future in such a situation. So the first question I had was coming from the UN. What is the relationship between healthcare and peacekeeping operations, and how did this COVID-19 crisis has impacted peacekeeping operations over the past few months, and presumably how the UN has managed to face that situation? Marta, if you can share with us some insights.
Thank you, David. I believe it's important to understand that there is a very close relationship with health security and peacekeeping operations. The United Nations is the provider of international peace and for very conflict-ridden countries. Our mission is to help the peace operations succeed with support and supporting solutions that are rapid, effective, and efficient, but very responsible with our role within the country that we're coming into. We work with UN and non-UN partners to plan, mobilize, and sustain operations in the world's more complex environments. The UN is increasingly deploying these peacekeepers to high-risk environments, and it's our mandate to keep the personnel safe, fit, and healthy so their role is fulfilled and the civilians in the countries that we are located in are also protected. The purpose of medical support then for peace operations is to secure health and well-being of all the members of United Nations, be it civilian or military, and to work in providing medical support under the command of these troops in order to have medical care for the people who are providing these very important services of peacekeeping. The health of peacekeepers and civilian personnel, as well as any international NGO that is probably located in our UN camps, is our #1 priority as the UN Secretariat. Therefore, it's our responsibility to facilitate medical, operational, and logistical activities in places where sometimes it's very difficult to bring in things, or where the health systems are not as strong as they should be. So it's very important to us to not tap and take away resources locally from the countries, but to be able to bring in our own resources to be sustainable without affecting them. This target cannot be met without providing all the inputs that are needed: infrastructure, trained personnel, the highest level of integrated work with the local ministries of health to make sure that we're following not only international global health standards, but also the local standards of the countries we are working with. Usually what we do in healthcare and peacekeeping operations is provide deployment of medical evacuation teams, which will bring people from point of injury to a level 4 facility, personnel to mandate certain health facilities in very remote locations, as well as provide all the inputs, medical equipment, consumables, pharmaceuticals, etc. With the COVID-19 pandemic, it was our role to make sure that every UN personnel, civilian or not, was tested, isolated, in quarantine, and had all the personal protective equipment to make sure that we would not be the organization that brought in the first case of COVID in certain countries where in the beginning of the pandemic there were no cases. So it was of key importance to us since February to be prepared to not be the people that brought it into a country, but be prepared to help the country instead. For us, we started adapting the daily operations, things that are very small, to include mitigation measures against the spread, to help protect the local communities while maintaining our operational continuity. Peace operations supported also government-led efforts to prevent and prepare for COVID-19 outbreaks at the country level. And under these new complex conditions, the peacekeepers are still undertaking all their vital work across the missions to protect civilians, facilitate political process, support disarmament, promote human rights, and assist in the rule of law.
Yeah, thank you very much, Marta. I can really relate to one of your comments on the reputational risks that some of us are exposed to when we are trying to do the best. However, we run the risk of being perceived as the vector of the disease, even though our staff might actually be there to help people. But the perception from the local people that we are trying to help might be, oh, those guys, we don't know them. And it's always the first reaction of a human person to suspect that the stranger is responsible for whatever bad things is happening to me. It has happened during Ebola. If we remember, some nurses in Guinea were being chased away from villages where they were trying to treat people just because they were looking so suspicious with their white gear. And yeah, it's a very important comment. Having said that, I would like to open up the floor for our other colleagues there who might have anecdotes or comments to share with respect to what you just said. Gentlemen, if any one of you want to take the floor.
Thank you, Marta. Really appreciate it. It's not an easy thing to do. We are living in a very, very unprecedented time. Remember, this happened last 100 years ago, so nobody can claim to have experience in this. I'm sure all of us 100 years ago were not around and were not able to have that experience. But I must say, all these efforts we have been doing together on preparedness, all the efforts we have been doing together in serving humanity are contributing towards this. And I want also to emphasize the point David has just mentioned. I happen to have been the one leading the coordination in Sierra Leone, which was for Ebola, which was really very complex. And they really were sometimes perceived as vectors. And negotiating your role, your way through may not be so easy. I just told you at the beginning of this meeting that I'm here under quarantine, and yet I'm the director of emergencies for the region. And I traveled 12 days ago to help some other country, and I can only travel again after 14 days. So these challenges of the needs are there, and you have the capacity to address them and to meet those needs, and you are available. Can't be on the ground sometimes is a real challenge. And as I said, things really happen locally. You may strategize, you may do everything globally or regionally, but things happen locally. So this is a real challenge, and I would like to highlight that a lot. It doesn't end with this. We have lost colleagues in such responses related to, of course, the response itself, but also related to the real threat. You must have heard of how I lost some of my staff in the recently ended Ebola outbreak in DRC. Some were point blankly shot by gunshots, not by the virus itself, but others were infected by the virus. So as peacekeepers, as peacekeeping force, as health providers, health security has that, which I'm going to call a risk, but also we have a unique calling to provide services to the most needy. So I really want to highlight that, to encourage all of us to continue doing the good to the people who best deserve. And they will be in that very difficult situation, and yet we have to provide the service. Then finally, of course, to do that, it needs a lot of strategies. Some of them, I'm going to say in my last words, nobody can do it alone. For me to airlift something from one place to another, whether it is PPEs, medicines, and so on, I'm a health expert. I will need support from the other organizations. To function well, we need that broader multi-sector, multi-agency action. That's why we're able to leave everything and come for this very important multi-agency and cross-sector panel discussion. Thank you.
Thank you very much, Zabulon. Rest assured that our thoughts and prayers go to those who have fallen in the line of duty and of course their families. Girum, if you have anything to share with us now.
Yeah, just briefly, thank you very much. Thank you, Marta, for a nice explanation. And thank you all of you for sharing your views. The occurrence of emergencies, outbreaks, and health threats in one nation, in the region, and the continent become a security issue now more than ever. So people are now realizing the need to have healthcare financing in a more strong way, and also investing on health, on early preparedness and early warning systems is a must now. So I think this pandemic and the previous ones are always teaching us a lesson to better prepared and also to invest more on health. So another area is the need to form effective partnership and collaboration with partners and the private sector, and also the governments need to realize every opportunity should be handled very carefully and in a very effective dialogue, and also in a form of trustful partnership. So investing on health and doing interventions on health need everyone's input and cooperation, and we need to join hands, and nothing can be successful in isolation. So this is a high time when the pandemic comes. This is a high time to realize to invest more, to be prepared more, and also to collaborate better. And our healthcare workers in all fronts are the frontline workers that are subjected and also fighting any disease and any threats at the forefront. So the need to also consider every necessary interventions put in place to protect the frontline workers, the healthcare workers, and also strengthen the health system. This is what I want to include on this panel.
Indeed, thank you very much. Yeah, I guess we all benefited from the fact that Ebola had happened before, and you are maybe just like us in the African Development Bank. Fortunately, when COVID started, we still had a stock of thermometers, for example, that we would otherwise not have bought, and we wouldn't have them in stock. However, each disease is different, and the next one might not have the same symptoms, and thermometers might not be the right investment. It's difficult to ask for budget when you can't really qualify what the next disease is going to be. Nevertheless, yes, we need to be better prepared to react and cooperate and react quickly, because speed is of the essence when a pandemic starts spreading. Let me go back to the second question from our colleague Marta. And in fact, it's a very interesting question, because I'm curious about the answer from all of you. What has been the impact of COVID-19 on the healthcare supply chain for your UN peacekeeping operations? And I guess that broader question applies to all of us. What has been the quantifiable impact of COVID on our own operations in our various organizations? A quick question, maybe. How many cases of infected people did you get among your own staff? Did you get any casualty? And how did you handle those situations? Did you have to go through slowing down or maybe postponing some operations because of COVID? I'll let you take us through this.
Would you like me to start? Oh, okay. So to me, the question is, I made it broad because I think it affects everybody, not only what we are doing. I think COVID-19 not only took a significant toll on the health system around the world and the casualties, but also led to an acute and drastic shortage of essential supplies, like you were mentioning, including the personal protective equipment, diagnostics, and everything related to oxygen production that was necessary for ICU equipment. I think that in our case, just as Kovind said, we had been working very closely with WHO on the Ebola response for a long time. So many of our peacekeeping missions and entities had a stock of preparedness to confront potential Ebola outbreaks, and were quite useful in the moment where everything started to lead into a huge demand that provided shortages. Massive factories were closed down and couldn't produce the items that we were needing, and prices increased astronomically of things that you could actually get really quickly and at a very fair price. You would see a ventilator going from $5,000 to $45,000, $50,000, the same type of ventilator. And I think this that's when the UN decided to establish the COVID-19 supply chain system to provide countries with essential supplies needed for the response. In that way, the UN, led by WHO, with whom my colleague is here, tried to implement a global strategy where every single UN entity came together to ensure access to critical life-saving supplies that WHO actually identified. And upon that identification, we looked at a delivering as one approach. So there was no more UNICEF and WHO and UN separate as entities, but trying to work together, everybody that works in supply chain, actually trying to find a strategy. And we have created these consortiums to purchase these items to try to ensure that we can meet the demand. It's been very hard because you're trying to consolidate a global demand from every single country and every health system. And we have tried to involve different partners around in each country. There's a coordination, and perhaps my colleague knows a little bit more about that because he's been more directly involved in it. And internally, what we did is that we did a supply chain impact analysis. So back in February, we decided that what happens if this turns into the worst? And we started to see what would happen if there are no flights, because every single week an airline was canceling flights because of COVID. And we're moving things through the air. It's too slow to move it via boat. So we started to look at things and started to place orders, as you said, in the hopes that they would be used. And that really helped us for the initial part so we could cover sometimes. We also changed the nature of the way we did things. We're usually rotating troops very quickly every 3 to 4 months to avoid them being tired and in a very difficult environment. To keep everybody safe and healthy, we consulted with the member states that provide the troops to come into the countries, and we decided to delay all the rotations in order not to be the vector that would be bringing in COVID in countries that back in March and April perhaps were still very, very low and there were no cases identified. We established quarantine spaces that did not exist, isolation spaces, have moved forward on purchasing diagnostic equipment that wasn't our forte. We're more about immediate emergency response, life-saving, limb-saving surgeries are the usual things that we do. And we have opened up labs in every one of them so we can make sure that we don't take the testing from the local hospitals, and we have a small portion of tests that we can do for people who are symptomatic or asymptomatic and will be traveling or coming into the country. So we have actually changed the way we do things completely, shifted it around to be prepared and to have a positive impact instead of a negative impact in the communities that we're serving.
Yes, thank you very much. Indeed, during the first few weeks of the pandemics, many countries were confronted to that dire reality. On the one hand, willing to take measures to quench the spread of the epidemics, but on the other hand, not having the supplies to implement the measures that they had decided. Initially, here in Côte d'Ivoire, you were not supposed to be able to come into the country if you didn't have a fresh PCR negative test. However, flying all the way from France, there was no way I could find in France a laboratory that could actually take me on the spot, like the day before or 2 days before my flight, to deliver my PCR test results. So in France, it wouldn't work, and here in Côte d'Ivoire either, and I guess that in many countries, some of the measures they wanted to implement were thwarted by supply chain ruptures. Gentlemen, do you have any similar experience you would like to share with us?
Sure, David, if I may.
Yeah, please, do.
Really to appreciate that this is extraordinary. This is a time when all the countries in the world need the same supplies at the same time. And this is the real thing. If you are talking about PCR here, you are talking about PCR anywhere. You want a machine there, you need a machine everywhere. So this has been that demand, global demand at the same time. And of course, with all the initiatives which Marta has highlighted, plus what I'm going to highlight later, we have silver lining. There's always opportunity. When things look dark like that, there's some nice silver lining. What happened? February, we had only 2 laboratories. If I consider my 47 countries sub-Saharan, that is the National Institute of Communicable Diseases in South Africa, down south, and then the Institute Pasteur Dakar. The 2 laboratories which were able to do PCR diagnostic tests for COVID. But then we knew that the flights were still continuing in our cases. As we live in a globalized world, a small village, we knew the cases would be here. So how would we diagnose these cases? And yet the gold standard, and the only standard at that time was PCR. So 2 laboratories in 2 countries in February. As we speak now, all the countries have that capacity. All countries can do PCR tests. As we speak now, some of these countries have more than 10, 20 labs, like Ethiopia. Girum, you let us know how many labs, universities, those institutions were able to do, are able to now do those tests. So building on the existence, David, your point of you had things which were left over from other emergencies. I want to stretch this to human resource capacity, the training people got in the past, the investment in preparedness, the investment in health systems. Africa Development Bank, we worked a lot during Ebola, but we have worked also on other things. When this other disease called Zika came recently, that was my first point. I said, where are you, our bank? And then we were able to get resources to work with the countries which are the highest risk, the Guinea-Bissau and the Cape of Verde that time. So building on existing capacities, including human resource capacities, logistics capacities, and having solidarity, working together as one block has helped us a lot. When the flights were stopped, and I think rightly stopped, because the perception was the aeroplanes are bringing the disease. Okay, so why don't you stop the disease? But you have stopped supplies from coming, you have stopped everything from moving. Negotiating the humanitarian space for movement of flights, specific flights, has been one of the great achievements we made. That negotiation took long, but UN flights were able to continue. I want to give also special thanks to Ethiopian Airlines, which continued for us. You know, it was easy now to talk. You can bring things from Dubai to here, to my local village here in Congo, to any part, because Ethiopian Airlines continued flying. Humanitarian flights continued. And then we were able to deploy not only supplies, but also the needed expertise to these countries, with a bit of difficulty, because when you arrive, they need to make sure that you don't have disease. So I arrived today with a negative PCR, but they still kept me in for 14 days somewhere when I should be providing services. So these are the challenges. But going forward with this, silver lining again, we are becoming stronger. The world is going to be different. We are better prepared. We know how to work virtually better. Some time back, we were holding these meetings in some hotels somewhere. We needed to travel. But today, David, we are here holding the same meeting. And I think the quality remains the same or even better in terms of cost savings. And also going forward, we really need to look at, this is going to be, really I would like to emphasize this point of supporting local production. Very interesting to see tailors using their skills to make PPEs. All countries beginning to produce masks for themselves. Seeing our textile industries converting those into complete PPEs. Seeing the liquor industries for alcohol, converting that into making things which we can use to clean our hands. So, local industry, this is a real opportunity for Africa to boost our local production of these things we can produce. This is the real opportunity to tap this oxygen, which is all over, oxygen concentrators. But the machines to do that. And then to do this well, we need global solidarity because the technology is somewhere else, but it needs to be transferred. So nobody can do this alone. Strong partnerships, solidarity, so that we have the technology transferred and then local resources are used to bridge some of these glaring gaps. So as I finish with this, most of our countries are now able to produce their own masks. They're able to produce their linen so that health workers can be better prepared, better dressed and protected from being affected, not only from COVID, from other diseases as well. And to sustain this, we need continued investment, not only on this short-term COVID response, but building on this to have a more long-lasting system strengthening. Therefore, the role we play in this as technical leads, but also the role we play in ensuring we have financing for that, we have the right instruments for that will depend on our strong partnerships. Thank you.
Okay, thank you very much. Girum, do you have anything to add to this?
Yes, thank you. I fully agree with you all. And, you know, the health system in general and supply chain management has been severely and highly challenged by this pandemic. And we know we have come from a very low level, including all countries in the region, and most of the African countries do not have the critical step of testing. So we have to rely on other countries like South Africa initially, and then gradually building up on the testing capacity of the member states. So we have tried to supply all the needed and equipments and materials. And of course, at the initial stage, we have to rely on donations from JACMA, China, and also other countries. But this also brought the attention of everybody, but especially the leaders and decision makers, to mobilize resources and all types of equipment from all over the world for Africa, for the region, and so on. But later, we have realized that we need to have the local capacity, as mentioned earlier. And you know, these plans were very, very delayed for many years in Africa and the region. But it was a top agenda of having a local capacity on manufacturing of pharmaceuticals, medical supplies, and it was a big agenda for Africa. But it was too late. I mean, too late to implement it for this pandemic. But we are on the right track, and we have taken a lesson that we need to build a capacity in Africa and in the region. So as I said, and as it has been mentioned, that many of the countries now realized they need to boost their capacity to manufacture locally, starting from mask, and even now Ethiopia has moved to a step of manufacturing testing kits. So this has been launched very recently, and this is a very remarkable move, and our region was very proud on that, and I'm sure most of the countries will follow, and the capacity built in Ethiopia and other countries will be shared by many of the member states and even for the rest of African countries. So finally, what I would like to say, all has been mentioned, and we need to strengthen the health system and also to build on whatever is existing on the supply chain management, and we need to go a long way to improve it, and not only for COVID, but when the pandemic is over, hopefully, and for other health threats and emergencies. So we need to build a capacity, and for that we need to invest. And for that also we need to convince the decision makers, and the leadership really need to think twice before investing on all other issues, because we have clearly seen on like a mirror, it's shown us, the pandemic shown us that if these kind of threats are coming, the whole economy, the whole social fabric, and also other issues will be disrupted. So we need to be prepared early and invest adequately. And the Ministry of Finance, Ministry of Health, and the Ministry of Foreign Affairs, and all other relevant stakeholders need to be committed to mobilize and work together with other partners, development partners, including the UN agencies and development banks, and also the private sector. So you should be on board for all these kind of responses. So the response plan need to consider all, to put their inputs, their contributions, and also invest for a long-term preparation and prevention of health threats and pandemics like this one. Thank you.
Thank you very much. And indeed, there must be help to those new companies. There must be help to be launched, to be created. But I guess once we enter the post-COVID world, somehow we might need to also help them to survive this post-COVID world when the demand for their products might lower. And if we want to still have them around for the next crisis, we need to help them be there and survive, and therefore maybe diversify towards other products. But then it's another huge domain to explore, and I don't suppose this is now the time to discuss this. In the interest of time, I will just point to the fact that it is now 10 minutes past 3 local time. We've been meeting for the past 40 minutes. I'm quite happy to stay on for longer, but since we had agreed for an hour, I just remind everybody we've been there for 40 minutes. Let me quickly go to the next set of questions. We had 2 questions from Zabulon. The first one was, what are the roles and commitments of the World Health Organization in health security, including response to the COVID-19 in the region? I guess we have started talking about this broader question, but I will let you take the floor and take us through the description of the roles and commitments of the World Health Organization in the region. Please, Zabulon.
Thank you again, David. Just to put everything into context, we live in a globalized economy, and the countries are dependent on each other for goods, for services, for transportation of supplies. And therefore, if we do not get rid of the threats like viruses, like those germs everywhere, if we don't get rid of those everywhere, we can't rebuild the economy anywhere. Solidarity. So with that, I would like to describe what really World Health Organization does, recognizing that anywhere, everywhere, those keywords are very important. So WHO leads and coordinates the global response through country, regional, and headquarters. Country level, regional, and headquarters, global response. And to do this, we ensure that there's increased understanding of any threat, a new disease, or the disease which is trying to change its characteristics. We have to understand it, and then quickly have that analyzed and shared so that we understand clearly the transmission, the epidemiology in terms of who is at highest risk, and also the clinical features to identify this disease, and so that we have better response and we contain. So that critical knowledge is one of our key areas. So there I've combined coordination with technical support in terms of developing some research protocols, research agenda, and then coordinating the researchers. 2, based on this, we provide advice, which needs to be updated continuously. You remember very well for this COVID, the advice we are giving in February is now completely different from what we are giving now. And within this time, to build this knowledge and making sure that it goes into national preparedness plans and influences policies at national level is not an easy task. So this is one of the things we lead in terms of coordination. Again, nobody can do this alone. It needs a lot of partners. For Africa here, David, I would like to really mention the critical role Africa CDC is playing and our role in working, collaborating together on this. Africa CDC with the framework and the angle, the political angle, where Africa Union is a big influencer, has helped us to address some of the political bottlenecks as we give advice to the countries. Thirdly, to do this, we need to share information. Information sharing is key. If I have some information I don't share, then I'm being unfair to my neighbor. Your neighbor can be your neighbor in terms of the household, but also the country, neighboring country, the neighboring continent, therefore the globe. So sharing, global sharing of information. So as you have seen, we produce daily information and share this with the world. We work with other partners like Centers for Disease Control, US CDC, China CDC, and put all this together with academia, and then we share this information. On a weekly basis, we have made sure in this region, we have press conferences, sometimes together with the other players to inform people on what is going on. Not only here, but also globally. To make it more relevant to this meeting of health security, David, I would like to highlight the issue of this thing called incident management system, which originated from military. The role of military-civil collaboration in this. Some of the mechanisms which have worked very well to meticulously follow response plans, but also to monitor on daily basis what is happening, and to accountability have been borrowed from the military world. So military-civil relation is really, that knowledge has been applied in all countries. If you enter any country here now, you will hear people talking about the incident management system, a system which coordinates all efforts, multi-sector, all efforts, including the agencies based on your comparative advantage, so that no one is left behind, no capacity is left behind, all coordinated. So WHO is really pleased to have worked very hard with the CDC to make sure that countries have this system of incident management system to respond to this COVID, but also to other emergencies as well. So the role of therefore coordinating those partnerships, we do play a big role in that. And this is in line with the mandate given to us many years ago called the International Health Regulations. The International Health Regulations, which are legally binding, meaning that if I have a threat here, I must report this threat and actions must be taken here. And even if I don't have the capacity to do that, I must cry out and ask for support. I was so happy that we have acknowledged the role Jack Ma has played in this. We cried out, we said we don't have. And then they were able to give us some supplies. So WHO works with the partners to coordinate this. And also to make sure that the partners, to do this very well, in Africa here we have offices in each of the countries. When you enter any country, you will find there's a WHO representative, and then WHO linking with ministries of health, but linking with other partners, World Food Program, UNICEF, and so under the overall UN umbrella. And the resident coordinators have made sure that this coordinated approach is the way to go in the country with high-level political engagement, advocacy at of state level, and including all the other sectors. I think I will stop here with my inputs on that point. Over to you.
Thank you very much, Zabulon. This time I'll let colleagues speak first, and I'll keep my comment for last. Who wants to start? Anyone? Hi.
Me, David.
Yes, Girum, please, the floor is yours.
Yeah, thank you very much. Yoti has described very much about the role of WHO, and in fact, the only the only UN agency and the first UN agency that I know for health system strengthening and particularly medicine regulation and other guidelines, and is WHO. We heavily rely on the inputs and the guidance of WHO for many years, and member states are very proud and confident on the structure and the operations that are done in the whole world, particularly in Afro and in our region. So we have cooperated with WHO for so many years in medicine regulation and harmonization and guidance for medical products and supplies and so on. But particularly on the pandemic, on COVID fight, no nation and no system has been prepared for such a massive scale devastation. But what in the health sector we expect for many years is to have the minimum investment, the minimum supply, the minimum medicine and medical products to be available in the medical settings, in the healthcare facilities. But with this pandemic, what we have realized is we were not prepared, and we haven't invested, and we haven't convinced maybe the leaders to invest on healthcare. So we want the WHO to move forward hereafter, even to persuade the member states, and WHO is working on on behalf of the member states for the globe. And when I compare it with IGAD, IGAD is working on behalf of the member states, the 8 member states in the region. So the task is so enormous and very heavy, but my feeling, and this is a feeling of my colleagues as well, is WHO needs to persuade member states to adequately invest on health and better prepared, and particularly for the countries who are not prepared to invest heavily on healthcare, at least to put in place some funds to facilitate and adequately finance the healthcare facilities, particularly on these supplies that were highly needed on this fight of the pandemic. So we are very proud of WHO, but a lot to be done, and there should be a very strong leadership, a very strong pragmatic action for the member states to be obliged to at least to facilitate the healthcare facilities. And the frontline workers this time are very, very critically facing this disease, and they are the first to respond for this pandemic, and these people were not protected. This is what we felt in all the countries in Africa, particularly in our region. So we were helpless because we were not prepared. So at least the minimum investment should be there. Thank you.
Thank you very much, Girum. Marta, would you like to add something, please?
Yes, very quickly, I'd like to say that the UN Secretariat is extremely thankful for the support that we have received from WHO. We do have a big medical portion of work that we do, but most of the work we do always aligns to whatever WHO puts in place as guidance and guidelines. And I know most of my colleagues in Geneva and other places of WHO have been working tirelessly in developing these guidelines. I don't think anybody was prepared for what was to come. And I do concur that member states need to be better prepared, and that health should be an investment that everybody should be doing. Unfortunately, lately, this is something that all member states have been lacking in all the United Nations and more than 175 countries. And I think it's a message that is being right now, actually, as we speak, transmitted during the General Assembly to most of the heads of state, that the health security and sustainability is very important. But from our perspective, the silver lining has been that we have not been as together and united as UN entities and other UN partners that work towards health as we are now. I never had such a close relationship as I do now with my colleagues, and nor do our chief medical officers in the field with all the local WHO representatives. So I believe there's always something positive to see, and the positive is that we will be better prepared because we have been strengthening our coordination and the way that we work together into a more integrated way.
Yes, indeed, and that links to the takeaway point that I kept for myself when I was listening to you, Zabulon. Indeed, within your role of sharing information, I think that we need, all of us, like MDBs or NGOs and other UN organizations, we need to help you have the voice that you deserve. Because indeed, as you said, from day one, your organization's advice were very consistent. They remain the same, they've always been the same. And nevertheless, even though you have a recognized authority in the domain, that didn't stop a lot of people around the world relaying unreliable information, misconceptions, myths about the disease. And even though anyone in his right mind should have stopped listening to these people and they should have connected to your website, and everything was there from the first week. So yeah, we have made efforts to, every time we were confronted by people to have their own views on this, we try to convince them to actually do that, connect to the website, learn from WHO. This is what they are saying. But strangely enough, it's not so easy to give people a voice. And sometimes your voice is blurred in the midst of all the rumors that are being spread on the internet. So yeah, we take this as a very serious takeaway point. We must help each other when something happens, to have the proper prominence in the debate when we are the experts. And in that case, the expert was you. And that links somehow to the next question, and that's why I wanted to speak last. Your next question was, how is WHO collaborating with partners and different sectors in supporting countries to implement response plans for COVID-19? Sharing information and helping, disseminating the right information is probably one of them. But there's probably a lot more, and I will let you take us through this. Please, Zabulon.
Yes, I will be very brief in this, knowing that really colleagues have made very important points in terms of what we're doing together. But my big problem, my big point is no one can do this alone. No single country can do it alone. No single agency can do it alone. No single partner can do this alone. WHO and all of us responders thrive on strong partnerships. Partnerships beyond technical areas we have talked a lot about. Partnerships for better and sustained financing so that we build better systems for now and for future. Partnerships for sometimes very difficult discussions when a country says, don't enter into my borders. And yet we know the threat is there, would like to work together. So that type of thing needs stronger partnerships. Here, I want to specifically highlight the role of the regional economic groups, the RECs, the East African Community, the SADC, the WAHOS, all these groups, which have helped us a lot, the IGAD, which has helped us a lot, sometimes at heads of state level, to harmonize approaches. So, strong partnerships. Let me also highlight the role of private sector. With the resources, the private sector has been able to allow us to implement and to help countries to implement their guidelines. In Zimbabwe, you saw very clearly, testing was ramped up through the action of the private sector. What they asked from us is, what are the guidelines? And they were able to provide these guidelines, and they implemented the guidelines to the dot. So strong partnerships, because no one can do this alone. The challenge of coordinating that partnership is the work that we do every day. Sometimes, David, people preach the challenges as if they are problems. That's why I think it's the work to be done, working on coordinating our efforts together so that 1 + 1 can be equal to 5. so that we synergize our efforts. It's not so simple that I bring one, you bring another one, and there are two. Sometimes synergistically, we produce better results. So there are partnerships, nobody can do it alone. So as I said on, it is at country level, you will find in this coordination system, different sectors, education, you will find health, you will find the military, you will find the police, all working together towards this. And the enemy is the virus. So common goal to make sure this virus doesn't cause havoc. I will stop there knowing that the colleagues will provide maybe more examples. Over to you. Thank you.
Yes, thank you very much indeed. Has that inspired anybody in terms of your own views on what partnerships could be about in that sort of situation? Colleagues who would like to take the floor?
Yes, if I may, David, thank you very much. And that is also excellent intervention. I fully agree again in having partnership and collaboration on this fight and even beyond. So for IGAD side, for example, I want to share with you that all the development partners, including the UN agencies, including WHO, UNOPS, IOM, and UNHCR, are on board, including UNICEF, for agreed services in IGAD region. These agreed services cover quite a range of interventions like healthcare services, WASH, gender-based violence mitigation or gender action plan. And the most important on public education is the risk communication. And also in the early stage of the pandemic, we were tasked to establish quarantine centers and isolation centers. All this requires, support from different partners, and also the member states need to be very willing, and the leadership needs to focus giving attention at the, for example, critical areas like port of entries and also where the migrants and the refugees are also located. All these centers, areas or locations need a huge resource, a huge mobilization of technical expertise and human resource. So for this, we need to join hands, and partnership is indispensable and very, very critical for this action. So another lesson that we have taken during this pandemic and even before, which we haven't given adequate attention, was we need to sit down together and discuss and plan and make a very robust and comprehensive plan of action to do a meaningful approach for the fight and for addressing the real challenge. So, well, resources are very, very important, particularly financial resources. So, thanks to the big players in the globe, like the European Union and also the bilateral agencies, the development partners, now they have realized this is a very critical moment for us to join hands and put all resources together. So EU, for example, has made it clear that once we have an agreement of a clear plan of action and strategy, then resources are out there. So this is the biggest priority for the globe, for the continent, and for the region. So they have made it clear that resources will be pulled, and every task will be divided for different agencies based on their specialization. WHO, UNICEF, IOM, UNHCR, and even ILO is also on board to complement all these actions. So partnership, collaboration is a very critical thing to do on this issue. Thank you very much.
Indeed, Marta, would you like to add something?
Yes, well, I concur with all the interventions of my colleagues, and I will reinforce that I think collaboration and coordination and partnerships are key. We have seen it in trying to pool resources to try to fulfill the demand of all the health systems and the support that many UN agencies provide. As I said before, under the coordination of WHO with the COVID-19 supply chain system, there has been an intention of understanding what the demand is to support each country and trying to pool resources as set by the colleagues from different agencies. Anybody that has some resources, pulling them together and say, oh, we can cover this portion of the demand, and IOM can cover this portion of the demand that is intended, for example, for testing sites in refugee camps, working together with UNHCR. And not only inside of the UN have we seen that it's important, but actually bringing in partners that are not part of the UN, working with FIND, which has been evaluating all the PCR and all the diagnostic equipment to make sure that what we will be purchasing and putting out there is something that makes sense, that is scientifically reviewed and evaluated, and that passing through to WHO so they can make the last call and recommend something or provide emergency approvals. We have seen that everything that the pandemic has brought has not been negative, but it has enhanced the way that we work with outside partners as well. And therefore also the way we work with government and regulatory frameworks, be it the CE markings for items or the FDA approvals in the United States or regulatory approvals within the African Union. I think there has been some very good momentum that has showed us if we continue, even if COVID ends, we should leverage all these partnerships that we've already started with.
Yes, here at the African Development Bank, what I can say in terms of cooperation and our own contribution with respect to addressing the crisis in our various countries in Africa. Our role, of course, as a multilateral development bank is to fund and finance projects. We don't have medics going on the ground to help sick people. We don't build facilities ourselves. These are engineers' works. However, we support our countries, governments with budget support. Back in April, the African Development Bank had created a fund of $10 billion, and that we've been using in the form of budget support. However, the issue of coordination is, from our own point of view, better left to the sovereign country. It is up to each country to bring around the table the various agencies, UN agencies or international organizations operating on their behalf, and really take the lead in coordination. We don't see ourselves taking the lead in that sort of operations. We're only there to provide the money, really. But thank you very much for this. We are 1 hour already in the meeting, and I'm doing a very poor job at keeping time. I'm a pathetic chair, really, and I apologize for this. Let us move on to the last two questions emanating from our colleague from IGAD. So let me move back to where I was. So Dr. Hailu, you had a first question, which was, what have been the commitment, the leadership, and the key milestones for IGAD in response to the COVID-19 in the region? Can you tell us more? What have been your milestones?
Yeah, with pleasure. Thank you, David. Thank you again, colleagues. I'm sure you will agree with me, leadership and commitment of member states and the heads of states and governments is really very, very important. And if I may start, IGAD is one of the regional economic communities in Africa among the 8 recognized regional economic communities. And IGAD is working on behalf of the 8 member states in the region, mostly on the east. So we are saying we are part of the African Union, and the role of and mandates of REX is now more than ever strengthened at the African Union level. So this pandemic also tells us again, for the leadership and commitment of the heads of states and governments, and to work in a very concerted, very structured and aligned with the commitment of the African Union and also other global agendas like SDG and so more than ever. So having said that, IGAD immediately when the pandemic is happening, represented by myself, fortunately, it's my honor also to represent the Executive Secretary and the entire IGAD Health team to the African Union platform of the ministerial meeting held in February. So that time, this issue was highly, very shocking and very, for the most of the countries, it is unprecedented, and it's a high time to discuss. And immediately after that meeting, we have established a task force at the IGAD level, and that was in early March. And then we had also a ministerial meeting on health and on ministerial meeting on finance also, and then followed by developing a health strategy based on the member states' response to the pandemic. So we felt that this is the biggest priority for the region, and we moved immediately, and the leadership was very supportive, and all the necessary action was taken. And then in each country, we have focal points and also a coordination office linked with IGAD and also the African Union. With the support from African Union and Africa CDC, we have tried to catch up with all informations, and we have also linked ourselves with WHO for technical guidance, and we were strictly informing member states to report and give informations and so on. So this will tell you and will show you that no other time has been seen like this one, to have the leaders very committed and also mobilize resources from development partners. As I've said, the task is not only for IGAD and its member state, but for the whole development partners and also the private sector who are engaged and working closely with the governments in each member state. So we had a wonderful and exciting collaboration. I hope this will continue. And also we felt that this pandemic is a challenge, but it brought also an opportunity for us to work together. And in each country, at the district level, at the lower level, at the region, sub-region level, many of the partners would like to collaborate and support the government. So the leadership matters, and the leadership was very, very strong and vibrant. And also, there is a tendency to quickly realize that we'll have a health and socio-economic impact. Then, following the guideline from WHO and the other trends from the world and from the continent, many of the leaders were very committed and giving a high priority and attention. Thank you.
Thank you very much, Girum. Who would like to comment first, please?
Okay, can I come in?
Yes, Zabulon, please do.
Yeah, just to say a few things about the critical role, really the Intergovernmental Authority on Development, the IGAD played. I just want to give one specific example. 30th of March, IGAD was able to facilitate, enhance, and bring together all the heads of states. Because WHO had these guidelines, the health agencies had all this, but it needed a strong political commitment at highest level so that it becomes a priority, so that it is not seen as a normal disease outbreak, a virus going around, but as a security issue, as an economic issue, as an issue which is beyond health. It's not just about people getting sick and dying. So that meeting, which was held on the 30th of March, adopted a declaration. All the heads of states, including my own head of state, I was so happy to contribute to this, made very strong commitments in terms of political commitment, but also providing resources towards coordinated intergovernmental approach in all these countries, 8 countries and beyond. They also committed to facilitating an enabling environment for strengthening national public health systems beyond COVID. So when we are talking about systems strengthening, the critical role which really IGAD played in this, making sure the heads of states committed at that level has helped us a lot. So moving forward, I think as we said earlier on, the role of these sub-regional partners, the role of the regional partners, the global partners with the RECs interacting with the highest political level so that our strategies, so that our goals, our priorities of protecting the human life globally is addressed, is being facilitated a lot by these organizations. So I just want to really make sure that that is ahead, the role the RECs are playing, the role IGAD has played in the Horn of Africa and eastern part of Africa. Thank you.
Thank you, Zabalon. Marta?
I would just like to say that I concur that each partner and each authority has a huge role to play to implement and bring down, trickle down all the guidances that are provided and actually coordinating the actors on the ground. There would be no response to pandemic without coordination of these type of authorities, not only at the regional level, but in each country, responding at the district level with all different partners. This is key. There's nothing that can be done at a high level without the people down on the ground coordinating it. And we have seen it in the same way because we have worked with many partners from IGAD as well, with our chief medical officers and with our directors of mission support to try to align ourselves and always be coordinated and in partnership in order to, I think, use the resources wisely, be it human resources or even equipment or anything that we're bringing into the country. So I do concur with both colleagues that each one of us plays an intrinsic role, and this coordination cannot be done without organizations like IGAD.
Yeah, thank you, Marta. From the point of view of the African Development Bank, I would say that, and as I mentioned earlier, in April, we had created a fund with $10 billion available to help our countries throughout Africa. However, our help cannot arrive faster than requests are made, and we can only commend the attitude of the countries from the region, from IGAD, as they were really reactive and they were really proactive and quick to take the opportunity to get funding from us. Just a quick, as you were speaking, I just pulled a few statistics from our intranet site. But so on the 8th of April, the fund I mentioned was created. And starting on the 22nd of May, we started approving a budget support loans to various countries in the region, starting with Kenya, followed by South Sudan, and the next one was Ethiopia, Comoros, Uganda, Somalia, and Djibouti at the end of July. So you see, within 2 months, many countries had already taken the opportunity to get this extra finance to help combat the disease locally. That shows, a very commendable attitude from those governments. That is all I can say at this stage. So well done, guys. Well done. Moving next and final questions that was prepared for this event. So still with IGAD, what were the other funding partners and implementation plan to fight COVID-19 in the IGAD region? Obviously, we were one of them, the African Development Bank, but I guess we were not the only one. Can you tell us more? Who can we go and speak to if we need money?
Yes. Happily, I'm very happy and very glad to mention our partners, and this implementation plan needs meticulous planning. So the main thing is a political will and also the will from the partners to support to fight COVID. So I would like to mention the first partner in this fight, and also very generous, is the European Union. So the European Union has put more than 60 million euro for this initial fund for IGAD, so that to collaborate with other partners and also the member states. And as David mentioned, African Development Bank is the other partner. And there are also many bilateral donors, like the German government through GIZ, and the Sweden government. And also we have from private sector, the Trademark East Africa. And most importantly, both technical and financial support is coming from the UN agencies, primarily from the responsibility for procurement and also distribution of supplies has been given to UNOPS. And the other partner from UN agency is UNICEF, and the other one is IOM, UNHCR, ILO, and of course, WHO is very, very instrumental in availing all technical supports and guidelines and so on. So the IGAD member states are also highly committed to invest more and supply, provide funding through their Ministry of Finance, all member states, because as I've said earlier, moving into action against COVID, there was a call for action by all Ministry of Health and Ministry of Finance in early April. On 8th April, the Ministry of Health, and the 9th April, the Ministry of Finance, after the heads of states and governments meeting on early March, on 30th March. So after the establishment of the task force, IGAD realized to move to a step of mobilizing adequate resources, adequate finance, adequate technical expertise. So these are the funding agencies, and the implementation plan, briefly to mention, is as a finance coming from EU, the Ethiopian government, the people in Ethiopian government are very, very supportive in all aspects, from the early start of transporting these goods from different parts of the world. But in this EU supported and other financiers support, Ethiopia has been selected as a principal location for receiving and distribution of these medical equipment, vehicles, and also ambulances that will be purchased by UNOPS and then transported to Addis Ababa and then to the rest of the member states. So the Ministry of Finance, the Ministry of Health, and the Ministry of Foreign Affairs of Ethiopia have been very instrumental in lifting, in exempting duties, and also duty-free status has been granted, and the transport also hub has been availed. At this junction, I would like to also thank and mention that UNOPS has been very critical, because you know that UNOPS have an efficient and effective procurement and project management unit, and then we have been able to enjoy the support from UNOPS, so that this a meticulous planning and also early procurement plan has been designed, and all experts at the UNOPS were fully engaged, for many hours in a day, and they are working with us. And I'm also learning more from Addis Ababa to work with this agency UNOPS, and also the EU heads of delegation for procurement and distribution of the items, and also to mobilize the support from other agencies to fight this COVID and the pandemic. So the implementation plan is still going on, and also the funding partners have shown their commitment, and the first launch has been done in Addis Ababa at the Poly Air International Airport. And during this event, media advocacy has been given, and many partners are aware now. They are coming on board, and many private sectors are also on board. And in Addis Ababa, many pharmaceutical companies and companies that produce masks are also shown their interest. So advocacy and also the media day and media week has been done, and a number of interviews have been through the media communication has been done, and this has been very instrumental in supporting and what we are doing, and this will hopefully continue in a very successful way so that we can mitigate the impact of COVID on health and socio-economic of the countries and the people. Thank you very much.
Yes, I really was not surprised by the list of usual suspects you mentioned. We tend to work with the same partners, and for one good reason, and that's another takeaway point. It's much easier and faster to move into a partnership with people who share the same procurement rules and the same fiduciary controls. That allows us to be more confident that the resources that we lend are going to use according to the highest standards. And yes, it is very much easier to work with those entities than with anyone else, you know. So I'm not surprised to hear those names. Dear colleagues, anyone wants to share any views on this?
Yes, if I can just add 2 points. In terms of more resources, also I remember vividly how the declaration of the heads of states called for the international financial institutions, bilateral, regional, and especially the World Bank, IMF, Africa Development Bank as well, to rapidly implement debt relief and cancellation and provide now access to financial assistance. Many of our countries have a lot of to pay, and it was going to be really a huge problem as their incomes went down due to the COVID. And if these banks were not lenient enough, with strong collaboration and coordinated voice from the IGAD countries and other RECs, if this was not a joint effort, it was going to be difficult for them. So implementation of the debt relief and debt cancellation has been able to enable countries to put money into this response, into the systems, so indirectly generating that money. The other one is extending monetary and physical support to the manufacturing, local manufacturing capacities within the region. Of course, people had many ideas, but then they needed them to be better financed. So I've just seen from one of the reports how all this EU, World Bank, and including African Development Bank as well, supporting countries and supporting institutions for ramping up this local production, which I think, as we agreed at the beginning, is the way to go. For those things we can manufacture, we should make sure we have that local production. So injecting capital into that, injecting capital into developing human resources for local production would be a more sustained approach towards emergency preparedness and response in our region. Over.
Thank you very much, Zabulon. Marta, the last word for you.
Thank you. I truly, my work does not really relate to looking for funding partnerships, but more to seeing if we can collaborate. So I know that on the ground, we're trying to collaborate as much as we can with local countries. Not so much at a higher level because we provide more of an umbrella. So, and have delegated authority to our peacekeeping missions and entities. But I am sure that they have been collaborating with many of them. I've seen collaborations in Mali and a lot of work done by our colleagues in ECA, which is the Commission of Africa, and in Addis Ababa. So I understand that we are doing a lot of work to collaborate as well and to provide support in partnership with many countries.
Well, thank you very much. This has been the last questions that have been prepared for this seminar. If maybe Antoinette is around, she might help us wrapping up now the session. It has been an hour and a half long. It's slightly longer than expected, but I believe that all of us were really passionate about the subject, and we all actually very much enjoyed making it last slightly longer. I know I did. If no one else has anything else, I might take a few points maybe that I really, will take back with me as takeaway points. I'd like to share this with you. But if anything, if I was to summarize one thing, is our ability to succeed when confronted to such a situation lies in our ability to use the most of our cooperation and our ability to recognize and cooperate with other actors who share the same concern, who have a similar mandate in helping our countries, who are physically present in our countries, especially when lockdown occurs and we find our staff stuck in countries and they have to cooperate with whoever is already there because no one else will be able to join in quite some time. So having partnerships already set before such an epidemic occurs is definitely something that we need to develop and make sure that we have, so that the next disease that come around the corner can be addressed as efficiently as COVID has. I know that COVID in Africa has not been as deadly as it has been in other continents. Nevertheless, it could have been worse. It can still be worse. It's not over yet. COVID is not behind us. The virus may mutate, it may change. And therefore, we need to foster those bonds that our organizations have developed among themselves so that we are in the best possible position to assist our countries. I don't know if I've captured with those few words, sentiments that is shared around. If I have missed important points, please intervene, please share with us what you believe were the key takeaway points. Don't be shy.
No, David, just one point.
Yes, Zabulon.
Learning from all this, we are not well prepared, and I'm not sure if we will ever be 100% prepared. So it's a learning process. We need to recognize that. But while we tackle this pandemic now, when we are tackling it, we are learning, we're using innovative ways, we are using everything possible. We must not lose focus of other health issues. We must ensure continuity of essential health services. Our center of action must be that person, people-centered approaches. There's going to be no need if your response is going to imprison people. So we really need to have that people-centered approach and ensuring that even if people are living in squalid conditions, very difficult humanitarian settings, where water, sanitation, we are telling people wash your hands. Is there water? We are telling people put on masks. Is there the mask? So such people should not be left behind. If you leave one part of the world behind, that risk will spread to the other parts of the world. So local actions to respond to this global response. I just wanted to, really, you summarize it well, but I just wanted to emphasize those points. Thank you.
Indeed, local responses to face a global threat. Yeah, it's a nice way to put it. Thank you very much. Girum, you wanted to say something?
Yeah, just to emphasize 2 points. One is, collaboration. You have summarized it very well. And we need to have this healthcare financing, investing on health should be a priority for any member states, and at the regional approach also, this should be a top priority agenda for heads of state and governments. And on the investment will be on early warning and preparedness, and also adequate surveillance, technically adequate surveillance system. We need to also have a robust and a very effective and comprehensive response plan. We need to have this. For this, we need to have adequate financing. So this should be emphasized. And the third point is we have so many plans at the continental level, and member states through their regional bodies like IGAD and ECOWAS and SADC need to support the plan at the African Union level. So there are many plans, for example, the African Medicine Agency and also the PMPA, the production of pharmaceutical manufacturing plant for Africa. These are all in the pipeline, but we need to accelerate it, and we need to be action-oriented, and we need to move fast to respond to such untimely and unexpected disasters. So all these continental agendas need to be implemented and supported by partners so that member states will be better prepared and the regional economic communities will play their role. So accelerating the already available or the already committed member states are committed on these plans at the African Union level. So we need to accelerate on this and move fast. So the other final point I have is there are those vulnerable groups, especially at the IGAD region. We have migrants, we have refugees, we have internally displaced persons, and also at the cross-border of each countries. The cross-border mobile populations are so huge, and because of trade facilitation and so on, people are on the move. So we need to give attention for all this, including the host communities that are supporting this mobile population and refugees. So facilities in these areas are scanty and very, very, very fragile and very vulnerable. And also we need to collaborate, member states to member states, and also through the regional platform, we need to strengthen these areas so that the people will get adequate service, quality service, and also the vulnerable groups will be always recognized. And through the member states' health system, the health system needs strengthening, addressing these problems which I mentioned above. And thank you very much for this opportunity.
Thank you very much indeed. Marta, one final word for the wrap-up for the history books?
No, thank you very much. This has been a fantastic experience. It's very good to connect and learn of the work that is being done on the ground with the colleagues. It provides you with a different view and feedback. And I think my biggest takeaway of this is that we need to be more prepared. We need to continue the collaboration and the partnerships that we have already established and leverage them to build a stronger worldwide health response by strengthening health systems in the countries for the member states, and trying to figure out what our role is during our specific mandate by leveraging these partnerships and new connections that we have made.
Indeed. So yes, we are living through a very difficult time. However, it is nice on an occasion like this one to realize that we're not alone. None of us is alone. We share a lot, and we can help each other. And I'll leave this space today living less lonely. And for this, and even for this alone, I should be thanking our hosts and organizers of the ASEC 2020 team. Thank you very much for you guys for bringing us together and allow us to exchange.